Welcome everyone to the Greenwich United Way's annual legislative breakfast. We've been doing this for quite a number of years to get the legislators together to talk about the human services needs of the town of Greenwich. Of course, we appreciate all of you for being here today. For 90 years, the Greenwich United Way has been uncovering unmet needs, raising awareness and support, and delivering lasting solutions that many of you know about. Certainly reach out to me if you want to chat about any of that, and we hope to be doing that for another 90 years at least. I want to let you to know that Hector is going to be a little late, so that seat is empty right now, but he let us know he's going to be here arriving a little late. I want to introduce our moderator now, and we can get on with the show, as it were. Demetria Ganyas is on our advisory board, and she's also our moderator today. Please welcome Demetria. Thank you.
Thank you so much. It's a pleasure to be with all of you this morning. I want to begin by sharing some house rules for the conversation today. Of course, everyone will have the same amount of time to answer the designated question. Please, no interruptions when a colleague is speaking. Importantly, please stick to your allotted time. Rob will be sitting in the front row and alerting you to cue you when your time is almost up. And for the audience, if there is a topic or question that isn't answered in the formal part of this program, of course, please feel free to either speak to one of the elected officials or to speak to someone from the United Way. We're more than welcome to have the conversation with you when this formal conversation is over. And today's questions are solicited from the community and were shared with the Greenwich United Way regarding the topics most pressing in Greenwich. So let's begin. I'm going to ask each of our elected members to please introduce yourselves. Let us know your name, the community you represent, the list of committees you serve on. And then to finish off that question, we want to talk about some peaks and some goals. If you can let us know what you consider your greatest legislative achievement of 2023 and what your number one legislative goal for this year, 2024, is. If we can begin, please, with Mr. Fred Camillo.
Thank you so much. Good to see you. Good morning, everybody, and welcome to Town Hall. Fred Camillo, born and raised here in town, serving my third term as first selectman, and I used to be in the House where my colleagues now serve, and also with Senator Fazio. So my greatest legislative accomplishment, it's 4 years since I've been in the legislature, but I think because I work with my colleagues here and I've testified a lot on bills up there, helping to protect local control of zoning, working with advocates across the state, including here in town. That was a big success. But going forward, for this year, for goals for Greenwich, continuing to focus on public safety, pedestrian safety, and getting a lot of these projects through to the finish line with public-private partnerships, and crafting a budget now that will hopefully meet the needs of our citizens with great input from all of our citizens. So those are the goals, to keep us at the number one, top of the rankings that we're at right now, and to improve where we're not at number one. So those are the goals for this year, and look forward to this forum. Thank you.
Thank you so much. Ms. Rachel Khanna.
Thank you, and good morning and Happy New Year, everybody. My name is Rachel Khanna. I represent the 149th District, which is portions of Greenwich and Stamford, and I serve on the Appropriations, Transportation, and Government Administration and Elections committees. I think we had a really successful 2023 legislative session. And one of my priorities when the session started was to find ways to fill some of the open jobs that we have in our state, especially in teaching and healthcare. And while we know that Connecticut is on sound economic footing, we have to do a better job of retaining current residents and attracting new ones. And to make that happen, we have to provide key quality of life services such as education and healthcare. And these are the exact sectors where we're having critical labor shortages. And that's going to impact the economic growth of our state. I had introduced a bill at the beginning of the 2023 legislative session to address the shortage of teachers and healthcare professionals. The bill was designed to recruit, train, and retain nursing and teaching students, and it passed with bipartisan support. Another priority in the last session was cancer coverage for firefighters. It was shocking for me to learn that in addition to the daily risks that firefighters face in just doing their jobs, they're also putting their lives on the line by wearing their protective gear, which exposes them to cancer-causing PFAS chemicals. And according to the International Association of Firefighters, 66% of firefighter deaths from 2002 to 2019 were caused by cancer. And in the budget, we provided $5 million for the firefighters fund for firefighters' cancer relief. So that was what I consider to be successful. I'd like to, in the starting session, I'd like to continue to build on the work we've done so far in workforce development, but also focusing especially on early childhood education and women's business development.
Thank you so much. Mr. Stephen Meskers.
Thank you very much. First, again, echoing my colleague, Happy New Year. And thank you to all of the nonprofits who are here today to listen to us, because it's important that we listen to you. And I want to thank you for what you do in lifting and raising people up with the efforts every day. I think there is nothing more important in the sense of both government responsibility and nonprofit responsibilities is to provide, protect, and defend, and aid the weakest links in our society. So I thank you all for what you do. I sit on energy and technology, bonding, revenue and finance, insurance and real estate, and this year I was appointed chair of the Commerce Committee. In terms of peaks in my career, I would tell you there's a couple of peaks I'll share on a personal basis, on a one-on-one, because those aren't always necessarily things I want to bring out, in a broadcast. But there are individual calls and cries for help or assistance during the pandemic that I'm so proud that I was able to help individual people. It's the job you all do, which I'm so amazed about. It's the call in the night from someone who's forlorn or forgotten, and it's lifting them up or solving their problems. And it is the kind of thing that sent me almost into a tremors and staring up at the ceiling at night for the individuals. And I have nothing but admiration knowing that you guys do that day in and day out. So I want to thank you for that. In terms of particular peaks on the legislative side, this past year we were able to secure funding for the Boys and Girls Club for the rebuild of their facility. I can't be prouder than that we were able to bring home some funding for that. And in prior years, there's a number of smaller funding cases. And, we're able to make a difference and bring Hartford down into Greenwich for the first time on the financial side. So those are the achievements, I'd say. Thanks.
Thank you so much. And Mr. Ryan Fazio.
Good morning, everyone. It's an honor to be with the Greenwich United Way again this year, and all the other important nonprofits and agencies who are in attendance today. You really are doing God's work and at the tip of the spear in protecting people in our community. I sit on the the Finance Committee, which is in charge of taxation, on the Transportation Committee, and I'm the ranking member of the Energy Committee and the Planning and Development Committee, which oversees all issues related to local governments, including planning and zoning. This past year, I was very proud to co-author 4 different bills, which eventually passed into law on a lot of issues related to economic opportunity and mobility. One bill to expand access to birth control, which I think is especially important for low-income and families in more rural areas. I passed a bill that will now make it essentially legal for charities to raise money through raffles and bazaars in the state, which might be relevant to a lot of the organizations in attendance needing to raise money. Passed a very comprehensive utilities and energy reform bill with my Democratic colleagues on the Energy Committee that will strengthen oversight of the utilities on behalf of consumers, and also bring us down the path of an all-of-the-above clean energy strategy that will eventually reduce energy costs to consumers. And finally, a bill that brings the state of Connecticut down the path of taking away college degree requirements for certain state jobs, provide more economic opportunity for people who might not have had the privilege of getting a 4-year college degree, but still possess the experience and the skills in order to contribute. And so in that vein, in this next year, my priorities continue to be economic mobility, especially related to providing an avenue to work, reducing licensing fees, greater healthcare access through reforming certificate of need, and also kind of improving our fiscal standing in the state, reducing the tax burden, and making sure we can make the right investments in critical programs and so on. So, pleasure to be here and looking forward to this next year in the legislative session with my colleagues as well.
Thank you so much. Well, of course, finances are always top of mind for residents, so we'll go there now. According to Greenwich United Way's independent research, it costs $151,000 for a family of 4 with 2 children in childcare to live in Greenwich, and $46,400 for an individual to meet basic needs. The latest ALICE report, and ALICE stands for Asset Limited, Income Constrained, Employed, highlights that the cost of essential budget items is outpacing wages. So the question is, what are you working on to address the financial strain that is put on working families? And you'll all have a chance to answer. We'll begin with you, Mr. Fazio.
Thank you. You know, when I talk to constituents, when I talk to people all across the state, I think there is consensus that the cost of living in the state is just far too high, and it makes it especially difficult on middle class and working class families to survive and thrive in the state, which is why we haven't had the population growth in the state over, say, 10 or 20 years that we'd like to see. I think there's 3 categories where I hear the greatest concern from residents. First, the tax burden in the state being the 2nd or 3rd highest in the country. Second, the utility costs, the energy costs being the 2nd highest in the continental U.S. And third, the constantly rising healthcare costs. And every year I make sure I submit several bills on each of those topics. I think we could do a lot to reduce the cost of each of those things for the average family. It was a positive that we had a bipartisan budget in the past year that reduced taxes for middle class families for the first time in a long time. But I think we could do far more to reforming our tax system, which is complex, broadening the base and lowering rates for middle class families. I think we could reduce the income tax burden by $1,000 or $2,000 on middle class families by doing that type of tax reform. Again, taking out the loopholes, taking out the special deductions for privileged industries, and reducing the rates on middle class and working class families. I put forth a plan, a 6 or 7 point plan to reduce the average person's electricity bills by $200 or $300. It's a complex topic. I was before the RMA a month ago talking about it, but I think we can reduce the average person's electricity bills by $200 to $300. And finally, by reforming certificate of need laws in the state, I think we could reduce healthcare costs by 6%. It's worked in other states. It's about time to do it here. So I think we can do on all of these topics to make it more affordable for working class, middle class people to live in this area and in this state.
Thank you. Mr. Meskers.
Thank you. I think the topic of income distribution in the United States is a bigger problem, bigger scope of problem. It dates from the industrialization and deindustrialization in the United States, where you find manufacturing jobs. And, you look at the Rust Belt, you look across the country. The solution is not a local solution. It's a national solution. It's bringing back manufacturing work, bringing back Made in America. It's working to revive the country. You saw some of that in the programs, the Inflation Reduction Act and the Infrastructure Acts that have come out of Washington to try to reinvigorate the economy. On healthcare, the only state I've seen any progress made recently has been in Florida, where they've applied to the FDA to import drugs from Canada. which is at some level a shell game because the drug manufacturers are selling their same drugs in foreign countries at about a quarter of the price that they sell in the United States. So the regulatory framework which is also a federal issue, has to be attacked to reduce the cost of living in terms of medical costs. If you look at the United States, our spending on healthcare and our results are not materially, or our spending is materially higher, and the results are not materially higher in terms of healthcare outcomes. So we need to reform the medical system, but that doesn't rest with us alone. I think at the margin, the comments from the senator related to the certificates of need, the issues there are valid. We need to drive down the healthcare costs locally where possible to do what we can. In terms of the cost of living, I think working on affordable housing, working on helping that housing issue in the state of Connecticut and across the country are very important. And obviously, underpinning it all is economic growth. So any motions to improve economic growth is what's going to lift the boat and give people opportunity.
Thank you. Ms. Khanna.
Thank you. Yeah, we know that the rising costs of household essentials is putting financial stability out of reach for so many families. And I think a key component in addressing that is increasing the affordability and availability of early childhood education programs, which I think is paramount when finding ways to ease some of the financial strain on families. Connecticut loses about $1.5 billion per year due to the lack of infant and toddler care. We also need to find ways for families to reduce their cost of living, and I think one direct thing we can do is to look at school meals. We can spend all we want on buses, textbooks, computers, other enhancements, but they're worth nothing when kids are hungry because hungry kids can't learn. And in the fall, I had the opportunity to visit 2 honors civics classes at Greenwich High School, and free school meals were by far one of the top priorities for the students I spoke to. And I'm working for the continuation of funding for healthy school breakfast for all and giving students who are eligible for reduced price meals to get them at no cost. I think these 2 actions would have a huge impact on our students because, like I said before, hungry kids don't learn. And just as importantly, for many families, the peace of mind that they get from knowing that their child will eat without them going into debt is really important. And I think the whole thing's a no-brainer, and it's something I advocated for in the past session, and I'm going to continue to advocate for in this upcoming session.
Thank you. Mr. Camillo.
Thank you. I think when we talk about the financial strain of working families, we have to remember that it's not just those that are on the lower income levels. It's middle-class people that work 2 and 3 jobs here that often don't complain and don't say anything, and we kind of sometimes overlook them. So I think we need to make sure that they're included in this also. With that in mind, we're crafting a budget, again, that always looks at people who may be struggling. And you don't want to make their lives any worse by throwing a lot of debt and taxation on them. So you try your best to look at public-private partnerships and look at ways for efficiencies to get these programs funded, but also to see that look at the metrics, how you're seeing if they're successful. Also getting the word out to people of grants and programs and things like that are available. We try to do that in our weekly e-blast and on our social media, which we're really building up with lots of following. So that's a good way of getting it out. And also, if there's an emergency that pops up, and I think back to when the pandemic hit, and I got a call from David Rabin about kids that were, free and reduced lunch. They weren't going to school anymore, and their parents weren't working. And so we had to we did an emergency, went to the RTM. It was a little controversial, but it was an emergency, and we funded the first $100,000, and then the United Way, they were going to raise $400,000. I think there was like $800,000. It was a great success, and it showed the community coming together. But you got to be willing and ready to step up when that happens, and having a good dialogue with organizations like the United Way and all the nonprofits that are here is a good way to do that.
Thank you. Connecticut United Way has 3 policy agenda items that it's focusing on for this legislative session. The first is to create a permanent and fully refundable Connecticut Child Tax Credit. The second is to leverage federal funds to expand healthy, no-cost school meals, as we were just discussing. And the third is to expand investment in Connecticut 211 information and referral. What are your thoughts on these, and will you be advocating for each? We're looking for a yes or no on each item. We'll start with you, Mr. Fazio.
I know you're looking for a yes or no answer. It does, I think, depend somewhat on the details of the proposal. I am for a child tax credit or child tax deduction. I think it does matter what the details of a specific proposal are. I think full refundability, creating a large negative tax liability does create some problems with incentivizing people to fully engage in the workforce, and we know, of course, that full-time work, a full-time job, is the ticket to the middle class. So I think we need to balance those things, making it financially easier on families, especially ones with kids, especially given that our federal tax structure, I think, penalizes families with children, and the fact that we want to create the right incentives to fully engage in the workforce and rise to the middle class. So I am supportive of a child tax deduction. Certainly, that was part of, I think, the House Republican budget in the past year. I am certainly supportive of leveraging federal funds to expand healthy, no-cost school meals. I think the resources should be focused on lower middle-income families. I don't necessarily think that lower or middle-income families should be paying taxes for free meals for rich families. I don't think that would be equitable, but I think using the resources available to us to expand access to free meals or subsidized meals for low-income families is a very good idea. And finally, I think the 211 information and referral system, where we're kind of centralizing information about programs available to the public, is a very good idea. I know at the federal level, there's over 100 anti-poverty programs. There's probably a similar amount on the state level. It's far too much for any single person to even know. So we need to make the resources available so people understand what exists. Simplifying the systems available too would probably also go a long way to helping people. So that's where I stand on the three topics.
Thank you. Mr. Muskers.
So the question is yes or no. And I hate to try to split that down the center. My preference in an early childhood credit is an early childhood credit for early childhood education. I would prefer to see the resources for families in poverty for early childhood education, which are early childhood education programs starting at, from daycare to early childhood education. If you look at the achievement gap for people in poverty, you look at the needs for childcare for people to go to work, it's providing a social safety network. So I wrestled between the idea of a fully refundable tax credit, which essentially is a check to the individual, versus the money to an early childhood education program. So again, for me, it's different in the details. It's not the requirement to work, if you will, to make the credit available. It's more that the money going directly to provide that safety network for early childhood education to close the achievement gap, where I would love to see that focus. In terms of the 211 number, I think there are two issues that arise that I find in the state. It's both the population's knowledge of resources from the state. I've had people approach me. There is an ombudsman for your health care insurance. I can't tell you, if I asked everyone in this audience, maybe two people would have raised their hand saying they knew there was an advocate up in Hartford that they could call when they're wrestling with their insurance bills. My guess is nobody knows that. Issues on housing, issues on every other advocacy, there's very little knowledge. So I'd encourage that. The middle question was, if you'd repeat?
It's regarding the no-cost school meals.
I think the no-cost meals, again, I'd look at that on a need basis, but I'm in favor of, obviously, hunger as it affects education. I think it's a priority to make sure that we provide meals where there is needs. So I'd just be supportive of that as well.
Thank you. Mr. Camillo, your thoughts?
I would agree with the senator and the representative about on the face of it, yes, that's definitely the last two, but the child care tax, I'd have to see the details of it. I think it's well-intentioned, but I've seen things where money is put into something and with very little, I don't want to say very little thought, but really a non-focus on unintended consequences. I think there was a bill, was it last year, to put money in a fund for kids as like a savings. And I saw some of the opposition to that, not so much the idea of it, but there was no clawback, no what happens if somebody, their circumstances change and they're actually doing quite well. That money is still there that could go to a child that would be in need still. So I think everything's, the devil's in the details in the devil's in the details, and the concept is great. I would just have to see what it is. And if these are bills up there and I see the details and my colleagues let me know, I will gladly testify in favor of them.
Thank you. Moving on to affordable housing. Affordable housing and local zoning are, of course, very complex issues in Connecticut and in Greenwich specifically. So what solutions do you propose to address the lack of affordable housing here in Greenwich? Let's start with you, Mr. Camillo.
Thank you. So I would, number one, continue the focus of working with Greenwich Communities, formerly Greenwich Housing Authority. Just 4 years ago, we were at 5.2% of the 10% mandate from the state. We're now up to about 5.8%. That's a great jump. We're more than double our neighbors that are not cities, which is good. And what we're doing is looking at a lot of these. The law in 1991 that was passed said that if there's something that's affordable that hasn't had $25,000 put into a unit, it's not counted. So we have all those units at Armstrong Court for years were affordable, but were never counted. Now they're all being counted because we're redoing Armstrong Court. So we really focusing on that, as well as looking at new units where that's not adding impervious surface, right? We don't want to add to the flood situation. So I think Greenwich Communities has a good handle on that. They're a great partner for us. Certainly the Housing Trust Fund that was passed a few years ago, was first attempted in 1988, rejected. This time it was passed. That's another tool, but our number one tool is Greenwich Housing Authority looking at units there that can be fixed up, but also asking our colleagues here who are trying their best to get the definition of 830G expanded to allow for other, because we're pretty sure we're close to that 10%, but the way the law is written, it just doesn't count a lot of things. So we've gone over this. It can be complex, but at the end of the day, if that law can be expanded and we keep working at it, and if we can even get above 10%, that's great. But it's also not just getting to the 10%, but it's doing the housing right so the people can live in a place that they love. And if you talk to anybody at the courts down there in Chickahominy, they're so excited. They're beautiful units, and that's what you want. So, but we're doing a good job there, but we have to keep focused on that. Thank you.
Thank you. Mr. Meskers.
Affordable housing is a national problem. It's an income-related problem. It's an access to housing. It's not a natural right, or people would tell you it's not a natural right, but people deserve housing. It's incumbent on the communities to address the issue as they see fit. But I would actually, as you ask me the question, I would turn the question to the audience. I'm your elected local representative. I have plenty of voices telling me what they don't want in the way of housing. I don't have many people in the audience that takes care of our community telling me what they want to do in the way of housing. Last year, there was a motion at the RTM to partition part of a fee from the firefighters into the housing trust fund. That bill was defeated. I don't remember if it was roundly defeated. I think it was defeated with maybe 20 votes. But I can tell you, as I sit on the RTM, I don't think I had anyone in the audience advocating from the nonprofits about what should or shouldn't be done in way of the housing. So I'll start by saying, I reflect the desires and will of the community, And I need to hear from the community at large about what the issues are related to housing. And I've heard from people who are advocates at very little at the margin, but I've heard from people who are concerned about their neighborhoods. Now, in the terms of development, I'm not an advocate for high rises, as people thought they would spend money in the last campaign. So I'm not skyscraper Steve in any manner, shape, or form. I do believe in affordable housing. I believe workforce housing. I believe access to housing is important. I believe that our workforce should be able to live in our community. So I'd like to see our community reach a consensus on that. And I certainly will be supportive of what the community wants up in Hartford.
Thank you. Mr. Fazio, your take on affordable housing?
Skyscraper Steve does have a ring to it. You shouldn't come up with these clever monikers for,
I'm sure
other people
it'll be
to
on
use.
TikTok tomorrow.
TikTok Steve's another good idea. So let's start, I guess, with the state level. I think that 830G as a state system, as state statute, has failed to deliver what we hoped, what was promised 30 years ago. There's almost no towns or cities that weren't at the threshold, that have reached the threshold in 30 years, and it's created this awful adversarial relationship between the state and localities. We need a collaborative approach, not an adversarial approach between the state and the localities. Every year I put in 3 or 4 bills to substantially reform the affordable housing statutes at the state level to enable us to have more local control while also moving closer to our affordable housing goals. I co-introduce it with a Democrat from Bethel every year, and we'll do it again this year and add to the ideas as well. But fundamentally, I think we need a collaborative approach between the state and the localities, not an adversarial one. 830G, I think itself actually creates a negative incentive to building housing, the middle housing, the workforce housing that doesn't qualify as affordable, quote unquote, because your denominator gets bigger as a town or a city every time you build, even if it's, if it doesn't meet the very, very precise qualifications under 830G, but your numerator, because you're forced to get to that 10%, doesn't increase. Even again, if it's a somewhat affordable apartment, even if it's something that could be affordable to a teacher or a firefighter or a policeman who wouldn't qualify for the actual affordable housing under 830G. I think on the local level, the town is doing very good work. Greenwich Communities, Fred, everyone in the town government is doing very good work, increasing our affordable housing stock by about 10% in the last few years. Planning and zoning is doing a good job of trying to do more residential in commercial mixed-use areas, making it easier to build affordable the ADUs, the kind of the in-law apartments, and the Affordable Housing Trust Fund provides a good arbitrage and valve from 830G for the town. Sorry to take up more time than I'm allowed, but again, very important topic. I think we can do affordable housing with local control.
Thank you. Let's go back to this issue of childcare because it's a big one for our families. The cost of childcare, of course, is expensive in Greenwich specifically and in Connecticut overall. It's a number we carefully calculated at Greenwich United Way, and it's roughly $2,500 per month per child for full-time care. The governor's recent Blue Ribbon panel on childcare highlights many of these issues. What solutions would you put in place to address funding, affordability, and access to childcare in Greenwich? Let's begin with you, Ms. Khanna.
Thank you. In December, I attended the National Council of or Conference of State Legislators Forecast Conference, and early childhood education and childcare came up as one of the big topics for all states for 2024. So we're really not alone in trying to address this issue. I read the Blue Ribbon Panel report on childcare, and we know that there's much of work to be done in our state. I also serve on the Early Childhood Caucus. Connecticut is home to 182,000 children under the age of 5. And we also know that investing in our youngest residents brings a 7 to 13% return on investment. So again, this is something that we really need to focus on. Our current system is plagued by chronic underfunding and high staff turnover. Wages in childcare in that sector are 23% lower than for those childcare workers than workers in competing fields. So I think we need to work to recruit and retain people in early childhood education and childcare and ensure that workers in the field are paid properly for this critical work, but also provide opportunities for career mobility and increasing recruitment. In the last biennial budget, we created a child care trust fund, and this is something that was also created in other states. So we need to find ways to fund it and to ensure that it has a sustainable funding source going forward. So this is something that we're going to be working on now. And within Greenwich, I think we need to continue to support the organizations that are providing early childhood education programs. And really, we're looking to you to tell us what your needs are so that we can go to Hartford and advocate for you.
Thank you so much. Mr. Hector Arzeno, I want to give you the chance to introduce yourself, as the others did at the start. If you can tell us your name, the communities you represent, and the list of committees you serve on.
Thank you. Good morning. Sorry, I am a bit late. Some personal issues. My name is Hector Arzeno. I am a state representative for the 151st district, the last district in our state. And I am on my first term. I also serve on the RTM. On the RTM, I delegate to the Finance Committee. And prior to that, I serve in 2 other committees. And in the State House, I serve on environment, education, and higher education and employment. Thank you.
I want to give you an opportunity to answer the question that we were just discussing. I can repeat it for you. It's about childcare in Greenwich and the cost being roughly $2,500 a month per child. Mm-hmm. And I wanted to ask you if you have any ideas for how to address the funding and affordability of childcare.
Very good. Yes. Childcare is a pending issue for us, and it was at the end of the last session. We all wanted to do a bit more. We did some. We made some progress. I serve also on the early childcare education caucus. And as Representative Cana just mentioned, I think that maybe it was a bit unnoticed, but there are 2 or 3 lines on the budget that we approved last year calling for a trust fund. That trust fund is very much alive. So far, there are only 2 or 3 lines. It's a definition. However, leadership is already meeting with the treasurer, with the controller, and we hope, probably not in this session. In this session, we expect to make progress drafting options for funding of that fund and options for the managing of that fund that probably will be on the treasurer office. And we have some ideas that we will be sharing with the governor's office on sources for funding such early childcare education trust fund.
Thank you so much. Mr. Camillo.
Something similar to, just a food line, some kind of what we did in the last session with the baby bonds that you might all be very much aware, and that was something that we work hard for that, especially the Black Puerto Rican and Latin caucus, and the governor was an interesting discussion with the governor, but it was great how he came out and the end result that our treasurer got. Thank you.
Mr. Camillo.
Thanks. I would just echo what Hector said. And that fund that was passed last year, putting money in for children, I think it's a really good idea. But again, we have to make sure that as time goes on, if something changes, I don't know that was some of the opposition to the bill, that if somebody's circumstances change, that money could then be diverted to people that actually could use it. So that needed a little bit more. But also I would maybe look to my my friend that I grew up with here in town, and my former colleague Beth Bai, who's Commissioner of Early Childhood in Connecticut. She's got some great ideas, and just, following the lead here and listening to you all with some ideas, but supporting our colleagues here in the legislature when they have a bill that's up there that we could all go up there and testify for. But again, just looking at things and seeing that just because it may be a good idea, making sure that there's no unintended consequences. And as we know, these bills, as someone once said, you could either read the bill or vote for it, but you can't do both. And the reason why is there's so much in those bills. Sometimes there's always something objectionable, but it's always the case. But I think it's a good concept, and hopefully it will succeed. Thank you,
Mr. Fazio.
That's a saying I hear a lot in Hartford, unfortunately. The Blue Ribbon Panel's conclusions were actually not very surprising. Probably most of you could have said that without doing all the homework, but that's okay. I mean, that probably means there's a lot of validity to it. And the conclusions of the Blue Ribbon Panel were that we need to reform the regulations and ratios surrounding childcare, that we need to reform some of the licensing with regard to early childhood educators, and finally, there needs to be financial resources dedicated to it. On the first front, Connecticut has among the strictest ratios in the entire country related to early child care. Across age groups, the requirement for adults to children in child care facilities is among the strictest in the entire country. For instance, if you just think of kind of preschool age kids, the ratio requirement in Connecticut's like 4-to-1 kids to a maximum number of kids to child care workers. In most states around the country, it's around, I think the median state's around 7. So, you're looking at potentially reducing the cost of childcare just by changing that ratio by almost 50% if you just change that ratio. But you don't want to change it too much because you're risking kind of quality and other concerns as well. So that needs to be part of the conversation. Absolutely. It would probably do most of the work. The licensing requirements for kind of pre-K type educators are very high in Connecticut. The costs of that license are very high for the people doing the job, not making a ton of money. I think it's like $900 for a child care license. Again, these are people, who are lower middle income people trying to do a good job, who are qualified. They shouldn't have to pay $900 for their right to work in the state. I have a bill every year that will max out any licensing fee to $100 in the state. And then there should be financial resources and subsidies for it. You don't want to make it so outsized that you're just increasing the price by bending out the demand curve, but there do need to be subsidies too. So I actually agree with most of the conclusions of the Blue Ribbon Panel and think it should be part of some sort of legislative package.
Thank you. Well, a recent report, Connecticut's Unspoken Crisis from Dalio Education, states that 1 in 5 of Connecticut's youth are at risk or disconnected. How can you help the nonprofits in town address this issue? You'll each have a chance to answer. Let's begin with you, Mr. Arzano.
Well, I think that we can certainly mental health and education is one of our priorities and number one issue. And the state, just going through our town, for example, and a few weeks ago, the three of us, Mr. Mesker, Kana, myself, met with Pathways, for example, and I didn't know how much money they get from the state, and I am seeing that the state is very much compromising with the needs of our youth, with the needs of our elderly, and all of the ones that had been affected and carry mental health issues. Certainly, there is more that we can do I mean, we are helping our nonprofits to obtain every time that we get an option for funding. We are on the front line, and we did it on the last session, and we will keep doing it.
Thank you. Ms. Khanna.
Thank you. According to the Dalio Foundation report, 63,000 young adults were disconnected and 56,000 students were at risk between 2001 and 2022, according to the data. These are young people who have either dropped out of school, are in danger of dropping out, or for those who are 18 to 26, unemployed and in many cases unemployable. I think we need to keep finding ways to keep students engaged in school and ensuring that they're getting the supports that they need in school so that they can succeed, and also pursue the avenues of interest that they want. And part of that, I think, is in recruiting teachers and becoming creative about apprenticeship and vocational programs to employ young people.
Thank you. Mr. Camillo.
Thank you. I think this has always been an issue, but it's been magnified and intensified in the last several years. Listening to the nonprofits who are out there. We have the Teen Center that was started by Icy and Scott France many years ago. That's changing a little bit now, the scope of it, but things like that, as an old club kid, the Greenwich Boys and Girls Club supporting their mission. As Representative Khanna just said, not everybody goes to college, and sometimes people may be a child may be in school and it's not their thing, but they may be very good with their hands, but they're made in this environment that if they don't go to college, there's something wrong with them. And the vocational schools, the trades, I mean, these are very good careers. And I know when I was in the legislature, Joe Arasimowicz was the speaker, and that was a big thing of his, and it was supported by people across the aisle to make sure that those trade schools were funded, and just keeping an eye out there, because things, especially we saw during the pandemic, this really intensified. So just supporting your organizations that are already in place there, and a lot of the nonprofits are always doing that already, but keep an eye on it, and if you can, it doesn't have to be money, it could just be your time and your sweat equity. Thank you.
Certainly. Thank you.
If I might add, our state university system is under distress, as you may all know. And just Mr. Camillo just mentioned the trade and the community colleges that are part right now of our state university system. And I live Yukon besides. And I think that in the state, and it's something that we are already started discussing at the Higher Education Committee, we need reforms. We need reforms on our state education system. Enrollment is decreasing, and those are issues that are very much on the front line, and we expect to face and look into in this coming session.
Thank you. Mr. Meskers.
I think dealing with disaffected youth and dealing with the lack of participation, I don't want to step away from responsibility, but you can see between COVID and social media, the amount of disassociative behavior is increasing. And it goes for youth, and it goes for the teenage years, and it goes for adults. People are becoming disconnected, and at some level, I question whether social media's impact on that. At the local level, what do we need to do? I think what we're doing currently, as we highlight some of your the groups, the nonprofits in this room, and their outreach to the youth, I commend them on that. What occurred to me as I'm sitting here is I was approached on one or two cases. I don't know that any of our nonprofits have taken up specifically dealing with the school system with youth at risk. and particularly those youth who end up in disciplinary programs who are then sent, quote unquote, to alternative education because they're disruptive. I'm not sure if any of us have championed that specifically. I would encourage us on that issue to do an outreach for the children who are no longer participating in school or are either unwilling or incapable of dealing with the school system so we don't lose them forever. Back at the other end of the spectrum, it goes to early childhood education. It goes to closing the achievement gap and giving children from the earliest days opportunities and inclusiveness. And obviously all of the programs like you see at the Boys and Girls Club that are sports related and academic related. You want to give children an outlet to feel included. So, I mean, it's somewhat some of the same, but it's a national problem. You can see it every day. Every time you read the paper, you see the level of problem. And I'm not sure I have the perfect solution, but I am listening.
Thank you. Mr. Fazio.
This is another very good and very important question. I'm sure we all wish we had more than 2 minutes to answer it, but we're facing the prospect in this state and in this country of an entirely lost generation due to 2 years of heavy-handed COVID restrictions and the atomization of society, the increase of technology and social media's influence, and general atomization, the decline of community, and so on. And kids are suffering the most, and kids on the margins are certainly suffering the most, and it's a crisis. And I think there's nothing sadder and nothing more important for government and for culture to address. You talk. The question asks about nonprofits' roles, and they play a role, and the state should be utilizing and leveraging all of the great assets that we have in this state with our nonprofits for supplementary services related to after-school programs and tutoring, absolutely. But this is largely, I think, a responsibility of schooling as well in the public education system. Kids spend about 25% of their waking hours in school in the most formidable years. And if the schools are failing the kids in inner cities, especially in low-income communities especially, then the government needs to step in and make sure we have leadership on public education in this state and around the country. Academic achievement fell in this state for low-income kids before the pandemic started, and it fell even more during, and that's not acceptable. But at the same time, we know what works. We have examples of what works in cities in this very community. Western Middle School went from the 160th best school in the state 10 years ago to the 50th best middle school in the state, and it's a Title I school. It's very diverse economically and ethnically, and because of the right leadership in that school, it's become one of the best schools in the state, and I think we're all extremely proud of Western Middle School, but it should be a blueprint for the rest of the state. Just across the border in Stamford, there might be the best school in the entire state, the Stamford Charter School for Excellence. 75% free and reduced lunch families, I think 99% non-white families. But if it was its own standalone elementary school district, it would have the second highest test scores of any school district in the state after New Canaan and ahead of Westport. Why isn't the state government going to these schools and saying, what are you doing and how can we bring it to every single kid across the state who doesn't have access to a great education? We are facing a crisis in this state, in this country, and it needs leadership in order to address it, but there are people who are doing it, and we can do it here too.
Thank you. I want to stick to the topic of youth. The Greenwich United Way, as you may know, in partnership with Yale New Haven Greenwich Hospital, is scheduled to open next month a youth and adolescent mental health intensive outpatient program facility at 500 West Putnam Avenue. It will be the first of its kind here in Greenwich. The question to you all is, what can you do to secure more funding and support to help us address the youth mental health crisis? You'll each have a chance to speak. Let's begin with you, Ms. Khanna.
Thank you. When I participated in this forum last year, mental health was a big issue, and regrettably, we continue to face a mental health crisis among young people. I have daughters who are in their late teens and early 20s, and they tell me so many stories of friends who are struggling. My youngest daughter, who's a freshman in college, told me of 2 classmates who are dropping out of school because of mental health issues. So it's really a nationwide epidemic, and we must continue to appropriate more funding for mental health while identifying solutions to address the shortage of mental health professionals available to care for and support those in need. And again, I look to all of you to identify what you need so that we can go to Hartford and advocate for that. We don't know yet how much we will have in, in the budget in the upcoming session. And we also know that adhering by our fiscal guardrails has served us well. And so it's going to be a difficult balance to find. But, these are, I think I can speak for all of us when I say that we are going to advocate for you and your needs.
Thank you. Mr. Meskers.
So, roundabout answers to the questions about mental health go back to social media, go back to the comments on various of the topics and responses we had today. Specifically to the program at Yale New Haven, I'd have to look at the community in service, the focus of who they're serving, to see what kind of state aid is currently available and what state aid we could bring to the program. I haven't seen the ask, so I can't address it specifically. But on a complementary note, obviously, Senator Fazio mentioned as well licensing. So one of the issues that I've been pushing for at the state level is reciprocity on licensing, so that skilled professionals in the tri-state, at least, or there are compact states which cover, I think, something on the order of 23 or 26 states. There are states that sign joint compact licensing agreements. I've set it up to our Department of Health that, schizophrenia is not either endemic nor unique in Connecticut, that the schizophrenic in New York and Connecticut probably have similar problems, and the licensing of the professionals that treat them should be the same. So that you need to give credit to people for the coursework they've done or their life experience as professionals so that they can cross state borders and practice. So I'd like to see more than anything in the short term. We need more training. We need more professionals trained and licensed. But I'd like to see the licensing restrictions lifted and to work cross-border to try to improve access to the service, which I think more importantly than a new service, which is not to denigrate the service at all, more importantly than the new service is access to professionals to provide the service. I can tell you that my recent search for a general practitioner was beyond painful in terms of finding people who were taking new patients. At the healthcare side, given what we've just commented about the scope and increase in mental health issues in the country, I guarantee you we are wildly understaffed across the board, and we're going to have to address that over the medium to longer term.
Thank you. Mr. Arzano.
Thank you. I congratulate Greenwich United Way for this partnership and initiative. Is something that certainly will be adding to our community. And yes, I see it very much at home as well. My wife is a psychologist, and so she's in the front line and serving youth, adolescent families with mental health issues. And I see how much the requirements, how much the needs for the services are in the town. And we are all of us, the four of us are on the front line in the state to get as much as we can do and funding for our nonprofits for mental health, for these initiatives. And maybe next year will be difficult. Basically, the budget is where it is, and right now the numbers that we are seeing in Hartford are not what we expected. And but again, we have a very healthy rainy day fund. We have financial guardrails, and the state is in excellent fiscal health. However, maybe next year will be tougher, and we'll have to wait for a new cycle in the next budget. Thank you.
Thank you. Mr. Fazio?
First of all, I want to congratulate the new Greenwich United Way and its new venture with regard to mental health. And we were at the main gala for Greenwich United Way a couple months ago, and the presentation was very deeply affecting. So we congratulate everyone involved in that and wish everyone the best of luck and know that we certainly support the efforts as well. I think programming that works should be invested in. It should be doubled down on. Evidence-based funding is an important role for the state. I do want to just mention the first bill I passed in my first year in office was to create interventions, pilot interventions on smartphones in middle schools in particular in the state. And we know all the concerns related to mental health and smartphones and social media. But again, being 25% of all waking hours of students is spent in school, having the right policies related to mental health in school, I think, is important as well. So we're going to have interventions in schools, districts, including in Stamford, and test the results, including taking away smartphones in schools for middle schoolers and having kind of educational program related to the cost to one's mental health and health in other regards from kind of these technologies as well. I can't help myself, so I'm probably also going to submit a bill this year that just bans smartphones in middle schools across the state and see where that goes, at least start the conversation. But I think the evidence is there. If we want an analog phone, on students in middle schools, that's fine. But I think the mental health repercussions of the smartphones on very, very young, growing, impressionable minds and psyches has been enormously damaging. And if we're not doing something about it, we could be in trouble.
Thank you. Well, of course, we have many more questions, but we have simply run out of time. Thank you so much for your thoughtful answers and your participation to all of our elected leaders. And again, please take this opportunity to ask more questions of them as we mingle, and of course of the Greenwich United Way staff if there's anything you'd like to discuss. Thank you so much. Happy New Year.